Today, we're going to be discussing a topic that I think will hit home for a lot of parents as well as school providers who may work with children of, younger ages. Today, we're going to be discussing ADHD, or attention deficit hyperactivity disorder. Again, I'm not diagnosing anyone here today. If you feel yourself and/or child may have some of the symptoms that I'm going to discuss or have any of the criteria, you are always able to reach out to a provider for help. And I want you to know that you are not alone. To go over a little bit about what ADHD may look like is it's a persistent pattern of inattention and hyperactivity or impulsivity that interferes with functioning as well as development, right? There can be several symptoms present before the age of 12. And for us clinicians to diagnose, symptoms have to be present for a minimum of 6 months, right? So 6 months, well, we think that that's just in one place, right? Well, no. To be diagnosed with this, we have to see several symptoms for a minimum of 6 months. And I mean, hey, sometimes we're not diagnosed until later in life, but that's okay. We're reaching out for help. We're getting help from someone somewhere, right? And that could be a primary care provider, that could be a therapist, somebody to assess and observe to see exactly what next steps could be made to help. Now, doesn't always happen in just one place. So like, for example, somebody's not just impulsive or inattentive in school, right? There has to be those symptoms present for that minimum duration in multiple areas of life. So for example, social situations, school domain, occupational maybe domain. I know at 12 we're not working, but if we are in different parts of our world, we are exhibiting these symptoms. So a lot of people have asked me over the years in my work in mental health, like, what are some therapeutic approaches that can really help someone, especially a kiddo that might be new to all of this, right? Well, group therapy can certainly be an option, individualized therapy. And again, if there is a child involved, working with a parent, a part of parent counseling and psychoeducation. So psychoeducation is where us clinicians work with the parent and or guardian to discuss, different alternatives for parenting styles, things like that, to aid with the child's continued development in a successful way. Sometimes we introduce med management. I myself cannot prescribe medication, but sometimes a CNS stimulant is assisting with that. Sometimes ABA or applied behavior analysis can be very helpful, and also school interventions, right? Like maybe providers can go into the school and work with the kiddo or children that are experiencing this.